The skin over the entire body is supplied by somatic sensory neurons that carry nerve impulses from the skin to the spinal cord and brain. Each of those spinal nerves contains sensory neurons that serve a specific and predictable segment of the human body. The area of the skin that provides sensory input to the central nervous system through one pair of spinal nerves is called a dermatome. The nerve supply in adjacent dermatomes usually overlaps a little bit. So by knowing which spinal cord segments supply each dermatome, it makes it possible for physicians and clinicians to locate damaged areas of the spinal cord. For instance, if the skin in a particular area is stimulated, but the sensation is not perceived or processed, the nerves supplying that particular dermatome may be damaged. This information is also very useful therapeutically. For instance, in surgery, cutting posterior roots, or if you infuse local anesthetics, you can block pain to a particular area. Cutting, of course, would be permanent blocking, or the local anesthetics would provide a temporary blocking. So because these dermatomes overlap, sometimes there may be more than one area or more than one dermatome that is affected because of a particular damage or a particular drug that has been administered. With the exception of spinal nerves T2 through T12, thoracic T of course, the axons of the spinal nerves don't go directly to the body structures they supply. Instead, they form networks on the left and the right side of the body by joining with the axons of other spinal nerves. These areas where they join is called a plexus. So we have a few different plexuses we'll look at, beginning at the upper part of the spinal cord. The cervical plexus supplies the skin and the muscles of the head and the neck, the top part of the shoulders, the chest, and the diaphragm. One of the major nerves and of major importance, of course, that is a part of the cervical plexus is the phrenic nerve. So here you can see the phrenic nerve coming off that cervical plexus. So the phrenic nerve, of course, supplies the diaphragm. So if something happens that severs the spinal cord above the origin of the phrenic nerve, it's going to cause respiratory arrest. So your diaphragm contracts and relaxes, and this is what drives the action of breathing, bringing respiratory gases in, and then the relaxation of that diaphragm causes you to exhale. So injuries to that phrenic nerve causes breathing to stop because the nerve is no longer sending impulses to the diaphragm, so the diaphragm is not being stimulated to contract. The phrenic nerves can also be damaged due to increasing pressure. For instance, if there is a malignant tumor in the trachea or the esophagus, so in that upper area of the throat and the chest, can increase the pressure in the mediastinum, pushing against that phrenic nerve. The brachial plexus is the interweaving network of nerves that supplies the shoulders and the upper limbs. Injury to the brachial plexus can result from forceful pulling away the head from the shoulders. For instance, if you fall on your shoulder, that can cause the head to be pushed or pulled away, or stretching of an infant's neck during childbirth. This injury is usually characterized by an upper limb where the shoulder is adducted and the arm is medially rotated. The elbow may be extended, the forearm is pronated, and the wrist is flexed. This condition is sometimes called waiter's tip position. So you can see that here in this image, the hand is flexed back as if waiting to receive money in the form of a tip. Injury to the median or ulnar nerves can cause numbness, tingling, and pain in the palms and the fingers. The inability to adduct or adduct the fingers, so the digits, depending on how severe the injury is. Wrist flexion can also be weak. Injury to the thoracic nerve can result in paralysis of the serratus anterior. The serratus anterior, remember, is one of the muscles of the chest that is going to cause the scapula to move. So the scapula protrudes and somewhat gives the appearance of a wing when injury is received to that thoracic nerve. The lumbar plexus is an interweaving network of nerves that supply the front and sides of the abdominal wall, the external genitalia, and parts of the lower limb. So injuries to the lumbar plexus, especially to the femoral nerve, which is the largest of these nerves, can result or can occur from gunshot wounds or stab wounds, severe cuts or injuries to the upper part of the leg. So these can result in an inability to extend the leg and a loss of sensation in the skin over the anteromedial aspect of the thigh. Injuries to the obturator nerve can result in paralysis of the adductor muscles of the thigh, so the leg cannot be brought in. It can also lead to a loss of sensation over a part of that thigh. This sometimes happens because of the pressure on this nerve by the fetal head during pregnancy or during childbirth. However, that is usually very transient and then basically fixes itself once childbirth has occurred. The sacral plexus is the network of nerves that serves the buttocks, the peritoneum, which is the area between the anus and the genitalia, and the lower limb. So here you can see the largest nerve in the human body, and that is the sciatic nerve, which is actually a combination of two nerves, which are the tibia and the common fibular. But the most common form of back pain is caused by the compression or irritation of that nerve, the sciatic nerve. It's also the longest nerve in the human body. Injury to the sciatic nerve results in something we commonly call sciatica. Results in a pain that can extend from the buttocks down to the leg, all the way down to the foot. The nerve can be injured because of a herniated or slipped disc, shortening of muscles that may occur during aging. It can, of course, be a result of an injury in the lumbosacral spine area or osteoarthritis. Pressure from the uterus during pregnancy, inflammation, irritation, improperly administering gluteal intramuscular injection, or simply sitting on a wallet for too long can compress the nerve and induce pain. Some common and often effective treatments for sciatica, especially in the early stages, are rest, pain medications, exercise, ice or heat, and massage.